Welcome to the Friends of Zane Adams, aka FOZA podcast, bringing awareness of postpartum depression, suicides, and the children who are left behind. We'll be spotlighting positive outcomes from mothers as well as healthcare experts and counselors. Would you know the signs of PPD? Would you know how to help a loved one? Stay tuned. As a community, we can do more to support maternal mental wellness.
Here at FOZA, we like to talk about stress and anxiety because that's what our postpartum moms talk about when we reach out to them. They want to reduce the stress and anxiety in their lives, and we want to help them find ways to do that. Of course, the first step is to always stay in close communication with your primary medical doctor and to remember that you're your own best advocate for conveying your feelings. Yet, we know that many women do not freely express their feelings of stress and anxiety. Sometimes that's because they can't articulate it. They just know that something is not right. We want you to know that those feelings are real and there's help available. If you feel down, speak up. There are ways to help that you can work alongside traditional medical solutions. There are ways to put you back on the path of vitality and productivity, and there are ways to find good health and ease in your self-care. Now, after getting to know today's guest from the information she provides and from speaking with her and learning about her own personal experiences and the programs she's developed, I realized how great it would be to have her as a guest with FOZA so she can share some of the ways that she's found to help postpartum moms the YIN way. Yes, I'm talking about Rachel Redmond. Rachel is the founder of the YIN way. It's an online program designed to help busy women and moms simplify their self-care so they can lead productive, fulfilling lives without burning out. And that's a sweet idea to a postpartum mom. Now, Rachel energetically describes herself as a doctor of Oriental medicine and an Ayurvedic practitioner, as well as an expert in ancient Eastern medical traditions. She specializes in women's health and self-care. Along with being a busy business owner, Rachel is a wife and mom. I don't want to keep you waiting any longer for her. So let's meet Rachel Redmond, owner and practitioner of the YIN way.
Greetings, Rachel, and welcome to FOZA. Thank you so much for joining us.
Thanks for having me.
You know, it's wonderful. I mean, when I say it's wonderful for you to be here, I've read so much, and of course we've spoken, in the past, and I really get excited about what you do because I don't have a lot of knowledge about it myself, so that means I get excited just from learning. So I'm sincere when I say we're grateful to have you here today. I know moms and the entire audience going to enjoy what you're going to be sharing with us. But can you tell us a little bit more about yourself and how you started on your journey to help women simplify their self-care?
Yes, I'd love to. And I'm really excited to share this information, this topic that I love to talk about as well. So my background is in holistic medicine and Eastern medicine. I started learning about Ayurveda when I was 19 years old. And Ayurveda is a system of medicine that comes from India. It's over 5,000 years old. It's a truly holistic medicine in that it incorporates the mind, body, and spirit, and that all those aspects are important for a person to feel healthy and well. So I started learning about Ayurveda when I was in my early 20s, helping my own body heal from chronic digestive issues and anxiety. I later went on to study acupuncture and Chinese medicine, where I became a doctor of Oriental medicine and a licensed acupuncturist. So I have this very unique background in health and wellness. And then I, fast forward, became a mom with my son, who's now 3.5. And so he's a busy age. He likes to pretend he's a robot, and there's a lot of emotions and things going on. But when he was a little baby, I remember standing at the sink washing bottles and feeling like so overwhelmed, so exhausted, just kind of beside myself in all of the things that I had to do for the house, for the baby, for my business, and then all of the things I had to do for myself because I had gone through previous loss and some depression and anxiety. And so it took a lot for me to take care of my own mental health. And I knew that it was crucial that I did that, which kind of boiled down to self-care in order to show up for my son, my family, without really falling apart. So I did kind of, standing there at the sink washing bottles, kind of have this critical moment of reckoning and realizing that, like, oh my gosh, it's actually not me who's I'm not the problem. It's not that I'm not good enough, capable enough, organized enough, productive enough. It's literally that we are living in this world that is not meant to really support us women, us moms, in a way that is healthy and productive and really connected. So that was a light bulb moment for me when I realized, okay, it's not me, it's not my fault. I live in this world, this collective, this culture that is, pushing all of this harmful conditioning and messaging upon me. So once I could separate myself from me and the water that I'm swimming in, it really helped me to start to gain some perspective and start to create a roadmap for myself, which I then began to teach to my clients.
Wow. Me and the water I'm swimming in. That's very powerful. I made a note of that. Rachel, I know that you're gifted to help many women, and that's your calling, to help them at various stages in life. If a postpartum mom is considering reaching out to you, she's listening to this, and she's feeling what you felt, so she knows that you've been there. What advice would you give her to start a conversation with you? In other words, what sorts of questions might she bring to you that would help her know she should go deeper with you and your programs?
Mm-hmm. She would probably, start by telling me that she's exhausted, that she's, just barely surviving the end of the day. She's so stressed out, and that she's noticing how this stress is starting to impact her physical health or her mental health. So she might be struggling with a variety of things, whether it's, complete and total exhaustion and burnout, or digestive issues that kind of spurred postpartum that haven't gone away. She might be experiencing more anxiety than usual, or insomnia, like let's say her baby starts sleeping but she's not sleeping. So many things can kind of crop up, and in the postpartum period, it's a very, I would kind of consider that the first year, not just the first 6 weeks, but it's sort of this, it's not a set amount of time. It's like however long it takes for that new mom to adjust to life with this new baby, whether it's her first baby or her fifth baby. So if she's struggling with any kinds of those things, then that is something that I would, be happy to kind of go deeper with her, give her so many resources, tools, coaching around how to be a mom but still be a woman and still be the person that she, knew she was before having a baby.
What you just touched on, that's what we get from a lot of our postpartum moms in the groups that we communicate with. They want to get back to feeling like they did before they started with their postpartum period, which many of the symptoms can start even before they have their baby, but they want to feel like a woman. They want to feel feminine. They're not necessarily happy with their bodies, and they're certainly not maybe happy with not getting any sleep or not having things turn out as rosy as they might have felt it would be. They love their babies. They love their homes and families, but they know that they are feeling, like you said, a little bit overwhelmed. Now, I'm going to talk a little bit about, I said, we work closely with moms, and we know that they work closely with their, we encourage them anyway, to work closely with their primary physician when they're considering any type of complementary or alternative care or just even thinking about it. And yet daily we meet women who they're nervous or they're shy about having the conversation with their doctors or their primary care providers. And we've even spoken to moms who say they've been shut down by their mainstream medical providers when they bring up the topic of Eastern medical traditions or anything similar to that. So can you give us a little insight on how a postpartum mom might prepare to have that talk with her doctor?
Yes. So there's a few things I just want to say to kind of set the scene of how this all kind of looks to me, is that I see Western medicine and the holistic Eastern medicine approaches as they're complementary and they can be integrative, but neither one is a replacement for the other. I don't think Western medicine on its own is a total and complete medicine, or, Eastern medicine like Chinese medicine or Ayurveda. I think in our modern world we need both modalities. So it's really important to know that one is not a substitute for the other. And two, where, let's say, Western medicine has its weakness, which is, its strength is in diagnosis, in treatment of disease like cancer, or getting a baby out safely during a complicated labor and delivery. Like, this is the shining aspect of Western medicine. But where it is weak and kind of incomplete is in the kind of wellness category, in the daily life. Like, if you go to your doctor and you feel, I don't quite feel right, I don't feel well, and they'll run a bunch of lab work and say, okay, you're healthy, and then the person leaves, they feel totally dismissed and like hopeless, because they're like, well, my labs might be healthy, but I do not feel healthy, and my doctor has really not much support for me. So this is where the strength of what I practice, Eastern medicine, steps in, because we have all of these tools and we have all of this understanding of how the body works, how the body relates to, nature, the time of day, the rhythms of the planet, and how all of this impacts us mentally, physically, and emotionally. And so just starting there is that we're not going to get everything that we need, let's say, from one physician or one acupuncturist or whatever it is. But it is always important to equip yourself with questions, advocate for yourself, and if you do get shut down by, a physician, then just keep searching. Maybe what you need is someone who can really help with the daily life, the routine, the nutrition, and things like this. And a great example of this, I have a wonderful relationship with my OBGYN, and I was telling her about my women's health wellness program, and she was telling me that, she sees moms all the time. She's also a mom about my age, in her late 30s with 2 young kids. And she says, these moms, they will return, 6 months, or a year later, and they're still struggling, they're still suffering. And she says, I don't have the time, or it's not, I don't have the time to do patient education with them. And so I told her about my program, and now she refers her patients to me because she knows that I'm filling a gap that she doesn't have the time to meet. And it's not really what she went to medical school to do. So, there is this beautiful way that we can integrate seamlessly these different modalities. So I would just hope a mom who's feeling overwhelmed, exhausted, not well, like, definitely speak with your physician. You might need lab work. You might have a thyroid issue. You might have something else going on. And also there's many supports from other modalities as well.
Well, Rachel, you painted a picture for us right there, because you touched on everything that our mothers tell us, so many things you touched on that should make them feel a bit more comfortable and not so guilty, and also not that it's a mystery or a mystique, and not so ashamed to say, I'm not getting everything I need here. I know you're doing the best you can, and I know that maybe, I'm having some medicine and I'm feeling some good effects from that, but in the midnight hour when I'm not sleeping and I can't sleep, or in some time when a sadness hits me, it's just, I know for a fact that there's not much you can do for me when I call you, my primary physician, and say, I'm feeling low. So we always want our clients to speak up. I always make a little point here to say we couldn't do what we do unless people spoke to us, unless the moms were brave enough to come forth and speak to us. And what you've just said, I'm certainly sure gave people confidence to say, okay, this is a safe place. I'm going to ask you about caregivers and partners, because I know you have a wonderful marriage and I know you have a wonderful family. So you have people around you. Sometimes moms don't, but we encourage them at FOZA to get in contact with us so we can put them in contact with people in the community. Are there ways caregivers and partners or other family members can help a mom be inspired to get in contact with you?
Since 1996, Don Paul Enterprises has been providing affordable web services to businesses and nonprofits. We have the perfect solution if you're not quite ready for a costly, fully developed website, but you need professional, mobile-friendly data capture functionality. Get everything you need to start growing your business online. Let us help you at donpaul.com and click on Affordable Web Services.
Are there ways caregivers and partners or other family members can help a mom be inspired to get in contact with you?
Yes. I just want to say to your point before is that if you're a mom and you're struggling, it can be so hard to reach out for help, especially if you're struggling with postpartum depression, anxiety. It can feel like you don't even have the energy to look up a number or pick up the phone. So just wanting to kind of hold a little space and say that I know what that's like. And then I was lucky that my mom, who lives close by, was able to help me in certain ways. She was able to help me make appointments with follow-up, health providers, and she was able to help me to find a support group, for things that I was struggling with. So this kind of leads to your next question, is that it is so, so important to try to surround yourself with 1 to 2 people who are going to advocate for you as well, who are going to say, I know that you're not doing well, and how can I help you? Because we know that it's really hard sometimes to help ourselves, and if you don't have anybody close by that you feel like you can trust, or if you're in a difficult situation, then it's really important to find someone in the community, whether it's a doctor, a therapist, someone who can help connect you to support, because, each mother matters, and we need, it's a difficult time in the postpartum phase and just the world right now. So we all deserve to feel better and to not suffer, and there is always hope and possibilities and resources.
Right. Well, you said a key word there for us, and that was connect. And that's what FOZA tries to do. As a matter of fact, we have a feature on our website named the FOZA Finder. And that's exactly what we try to do when a mom reaches out to us. We have a service where we look in her zip code within 10 miles of her, and we try to find resources according to what she may think she needs, because sometimes we don't always know what we need, especially in postpartum. It can be a confusing time, but as long as we encourage her to look for that primary medical care, and she's done that, and yet she's still feeling like she needs other resources, or she actually needs other resources, like she's worried about housing or worried about utilities in this pandemic world that we live in, then we do try to help them with that too. But Rachel, I want to talk to you about just the wonderful resources you put together, some of the resources. I know we're running out of time, but I know we have at least 2 I want to talk about, and that's your free guide for 5 steps to stress-free self-care. So we'll talk about that one first.
Yes. One thing I'm passionate about is helping women and moms figure out ways to incorporate self-care that is going to be sustainable and that is not going to be more on their to-do list, because we already have enough on our to-do list. And so based on my background training and my experience as a mother, I've figured out how to sort of break down this concept of self-care and how to take the certain things that we're going to do, like we're going to eat at some point, we're going to sleep at some point, we're going to hopefully move our bodies or, do the dishes or something, and that there are actually many ways that we can do this in a way that nourishes our body, that supports our energy and our health, versus sort of our unconscious habits that we might have that deplete our bodies and tax our resources.
I'm going to get that information from you, but I wanted to make sure that we also talked about the fact that you have supposedly an evaluation or something that will help people understand. You have a free self-care masterclass.
Yes, I do. It's a 50-minute presentation that is pre-recorded, so anyone can listen at any time.
Oh,
and
great.
in that I talk about 5 simple shifts or changes that women and moms can make to improve their health, reduce their stress, and elevate their self-care. So this, again, is more of my unique take on how to spin these topics in a way that can be easy and sustainable and simplified, because we all know moms don't need more to do.
Absolutely. Gosh, Rachel, can you believe how the time goes by? And you've given us so much of your energy. I know I felt it. I know the audience, even on demand when they get back to this, that they're going to come back to it again and enjoy some of the things that you said, so insightful. I love that you talk about self-care, because we're beginning to more and more realize. I just was speaking to someone just before we got on this podcast about self-care not being selfish. So I'm so glad that you have brought that full force. Self-care is important. It's not being selfish. I hope we made you feel welcome, and I hope that you will come back and join us again, because we want to have more of your enlightenment. But until you do, I'd like for you to please tell everyone how they can contact you.
Yes, and thank you so much for having me on, and I'm just really honored to be here and think you're doing really important work in the world. So thank you for that. And yes, you can find me. I'm on Instagram at rachel.e.redmond, REDMOND. That's me on Instagram. My website is rachel-redmond.com, and that is some easy ways to connect with me or find my free guides and masterclass and a whole bunch of things.
That's wonderful. So once again, FOZA fans, we've been chatting with Rachel E. Redmond, owner and CEO of the YIN Way. Rachel has designed her services to be totally accessible for you online. So please take advantage of her free guide with 5 steps to stress-free self-care, and get a consultation with her, or go ahead and take advantage of her free self-care masterclass pre-recorded information. The YIN Way. That might be your way to a more stress-free postpartum life. Well, FOZA fans, that's it for this episode. I want to thank you on behalf of our donors, sponsors, our supporters, everyone, for tuning into the FOZA podcast for maternal mental wellness. And special thanks to Ad Voices Digital Productions for producing this episode. I hope you gained some knowledge today that you can use in the self-care you so richly deserve. And if you're a family member or a caregiver, we appreciate you. You know, FOZA is proud to bring you all kinds of information to help stop the stigma, the silence, the suicides, and the suffering that often accompanies maternal mental health issues. So please visit our website, FOZAinc.org, that's FOZAINC.org, for an on-demand version of this podcast, and consider sharing it within your entire circle. And while you're there, please make a donation. Click on the link for Give to FOZA, Lift the Spirit. Every donation goes towards bringing awareness to maternal mental health. Once again, this is Paulette Smith signing off in loving memory of Christina LaShawn Thompson-Adams. Bye-bye now.